Ready?
Come in.
Hi, my name's Laura. I'm going to be your nurse today. Can you tell me your name?
Eugene Evans.
Hi, Eugene. Is it okay if I call you Eugene?
Yes.
Okay. Go ahead and sanitize my hands here. We're going to be doing a head-to-toe physical today on you. Have you ever had a physical before?
Yes.
Okay. So the first thing that I'd like to do is make sure we check your level of consciousness. Can you tell me what day of the week it is?
Saturday.
Can you tell me what time of the day it is? Is it morning or evening?
It's evening.
And can you tell me where we are right now?
At home.
Okay. Next thing I'd like to do is get your blood pressure. So we're gonna put this, goes on your wrist, and we're gonna hold it at heart level, okay?
Okay.
All right. Okay. Blood pressure is 136/84. That's good. So with a head-to-toe physical, we're just going to start at the top and we're going to work our way down. I'm going to check your eyes and your mouth, your ears. I'm going to listen to your heart and your lungs and check all your muscles, okay?
Okay.
All right, so the first thing that I want you to take a look at is your eyes. I see that your eyebrows are symmetrical, your sclera are white. Can you go ahead and pull down your eyes like this for me? Your conjunctiva are pink, that's good. No abrasions, your eyelashes look like they're evenly distributed, so that's good. Next thing I'm gonna do is check your pupils, okay? Right now they're measuring about a 5, so that's good, they're symmetrical. Now I'm gonna check and make sure that they constrict like they're supposed to. Okay. Okay, both of them constrict well to about a 3, and they did it at the same time, so that's good. The next thing I'm going to do is check for accommodation. If you can look off far in the distance, just keep focus on something there, and as soon as you see my pen light, I want you to focus on it. Good job. Okay, so your eyes constricted, so that's good. That's what we're looking for. Next thing that I'd like to look at is your mouth. So your lips are symmetrical, they're pink and they're moist. Can you open your mouth for me? Okay, your palates look good. Upper palates are pink and moist. Can you lift your tongue up? Okay, can you stick it out? Can you say ah? Okay, tongue is pink and moist. Your cheeks look pink and moist. Teeth are in good shape. Gums aren't coming up over your teeth, so that's good. Can you smile for me? Everything's symmetrical. That's what we want to see. Next thing I'm going to do is check your ears. So right now your ears are the same skin tone as the rest of your body, so that's good. They're round. There's no deformities or no drainage, no lesions in your mouth either. Okay, next thing I'm going to do is palpate your trachea, okay? So trachea is midline, that's what we're looking for. I'm going to check your carotid pulses. +4, so that's good. I'm going to pull up a little bit of skin right here, okay? It bounces back, so skin turgor is brisk. That's what we want to see. So the next thing I want you to do is hold your arms out for me like this. I'm going to make sure everything is symmetrical and even, no vascular deformities, no bruising. See that you do have some tattoos here. No ulcers or lesions anywhere. Okay, next thing I'm going to do is just check the temperature. Okay, if you'll turn it over for me. The temperature is same bilaterally, front and back. Okay, it's warm and dry, smooth. Next thing I want to do is look at your fingernails here. Fingernails are flat and pink, well adhered to the nail bed. Capillary refill is brisk, less than 3 seconds. No clubbing of the fingernails, that's good. I'm going to palpate your radial pulse here. +4 bilaterally, that's great. Okay, can you go ahead and pull your pant legs up for me a little bit? Thanks. Okay, so just gonna check, same thing, just temp. It's the same. No vascular deformities, no bruising, skin is even. Okay, I'm gonna palpate your dorsalis pedis pulsus here. +4 bilaterally. Okay, can you press down on my hands? Okay, that's equal, +4 flexion. Okay, I'm gonna sanitize again. All right. Next thing I'd like to ask you to do is just lean back for me. Okay. So I'm going to listen to your heart. I'm going to listen to several different spots, and then at one point I'm going to listen for a whole minute. Doesn't mean anything's wrong. I'm just trying to get a good listen, okay? So I don't see any heaving or lifting going on, so that's good. Okay. Second intercostal space, right sternal border is aortic. Second intercostal space, left sternal border is pulmonic. Third intercostal space, left sternal border is herbs. Fourth intercostal space, left sternal border is tricuspid. Fifth intercostal space, mid-clavicular line, mitral. I'm going to listen here for a whole minute, okay?
Okay.
Okay. Pulse was 74. I'm going to go ahead and turn my bell over here, and I'm going to listen to the same spots, okay?
Okay.
Fifth intercostal space, mid-clavicular line, it's our mitral. Fourth intercostal space, left sternal border, tricuspid. Third intercostal space, left sternal border, herbs point. Second intercostal space, left sternal border is pulmonic. Second intercostal space, right sternal border is aortic. Okay, didn't hear any murmurs or splitting, any extra beats. S1 and S2 were predominantly what I heard, so that's good. Next thing I'm going to check for is your abdomen, okay? So I'm I'm gonna take a look here. Looks like your contour is flat, so that's good. Umbilicus is midline, no protruding or signs or symptoms of any type of herniation going on, and hair is evenly distributed, skin is nice and even. So I'm gonna listen in all 4 quadrants. Vowel sounds are present, normal, active, all 4 quadrants. I don't see any signs of pulsation or peristalsis. The next thing I'd like to do is just palpate, okay? I want you to let me know if you feel any tenderness. Feel any tenderness?
No.
Okay, I'm gonna do it a little deeper, okay? Any tenderness? No guarding, no tenderness noted. I don't feel any abnormally large organs or anything like that, so that's great. You can go ahead and set up for me. Okay, next thing I'm gonna do is listen to your lungs. I'm gonna check your diameter here, if you'll sit straight for me. That's good, so anterior, posterior diameter is less than transverse. That's what we're looking for. Excuse me. So I'm gonna listen to several spots in the front, several spots in the back, 6 to 8 in the front, about 8 in the back, okay?
Okay.
Anytime you feel my stethoscope touch you, I want you to take a deep breath. Okay, doing okay? I'll listen to the back. Okay, can you raise your right arm for me? Okay. So I don't hear any abnormal lung sounds, no wheezes, rails, or ronchi. Your lung sounds are predominantly vesicular, so that's great. I forgot to check and make sure you didn't have any edema earlier. Let me go ahead and do that now. I'm gonna press for 5 seconds. Okay. No pretibial edema noted. Okay, the last thing that I wanna do is check your spine. So if you can go ahead and stand up for me. I'm going to palpate all the way down your spine. Have any tenderness?
No.
Okay, if I can just get you to bend at the waist. A little bit more. Good job. Okay, I don't see any signs of scoliosis, no lordosis or kyphosis. You can go ahead and stand up. If you want to have a seat back on the table. Let me make sure that I didn't miss anything. Okay, the only thing I can't remember is if we checked your you'll just squeeze both my hands. That's good. All right. +4 with your hand grasp strength. Do you have any other questions for me? Well, I think I've got everything that I need. I'll let the doctor know. He'll be right in to see you. It's nice to meet you, Eugene.
Good meeting you.
Thanks.